evening, everyone. We are back. We are back with Serena Niehaus. Serena is our clinical consultant for home care business advisors. And today we are focusing on home health. Home health, as you know, has so many interchangeable meanings depending on state. But Serena comes from a extensive background, clinical background, home care background, home health background, and is here to explain to us what are the moving parts of home health. So we have a three-part series that we're starting today. And today we've got the general aspects of home health. What is home health? Serena, welcome.
Thank you so much. I am so happy to be here this afternoon and join Home Care Business Advisors.
Well, we are absolutely glad to have you. So, Serena, we don't have much time, so I do want to, automatically just put it over to you and explain to our owners here what is home health.
Okay, well, home health is extremely challenging. It's very dynamic. It's very exciting. You have to have a passion for getting involved in an agency and opening it and serving the community. Under the home health regulations, home health it can sometimes be confused with the words home care. And there are different types of agencies out there. And most of you I know are in the home care arena, but this is the home health arena where it's the Medicare certified division of home health, where it is Medicare certified, and there definitely is a difference between home health and home care. So always think of home health as following the regulations of Medicare and all of the guidelines under Medicare. And as most of you know, there's like over 10,000 people every single day turning 65, and that's going to increase the baby boomers by 20% in 2030. So there's certainly a need to have home health agencies so that we can take care of the individuals in the community. And the whole idea is to make them, keep them at home and keep them safe and as independent as possible. Under the home health regulations and certifications, home health can bill Medicare and private insurance and commercial insurance. And and what home health actually is, depending on the state that you're in, would determine whether you need a license, whether it's a certificate of need state, which means it's like a liquor license. You can't just open up a home health agency in your area if it's a certificate of need state. So there's certain criteria that you need to qualify for home health care. Um, pay, Individuals that have Medicare or commercial insurance are 65 or over, but you may have Medicare because you've been a renal transplant, a kidney transplant patient. You might be on dialysis, or you may have Medicare because you actually have been disabled for 2 years. And when I say Medicare, of course, there's different parts of Medicare and different types of Medicare. So home health specifically is covered 100% under Medicare Part A. And there is no cap, no limit in terms of how much home care you can have, as long as you meet the eligibility requirements. And the eligibility requirements, you must be home to receive this intermittent skilled care. Home health is specifically skilled care. And when I say skilled care, there are 6 services under the Medicare benefit for home health, where you can receive skilled nursing services by a registered nurse or a licensed practical nurse, physical therapy, occupational therapy, social work services. The home health aid is covered by Medicare Part A, and that is because the nurse is actually supervising the home health aide, and it's an adjunct to the physical therapy and to the personal care that is provided to patients. But however, under home health, you have to remember that it's short-term skilled services. So patients think because I have this benefit, I can continue to, have home health forever, where I would have a home health aide. That is not home health. That is home care. And that's where it becomes, confusing to the general population and the community, whether it's home care or whether it's home health. So home health has to be provided and certified by a physician, whether it's an MD, a DO, a nurse practitioner, a physician's assistant. And since COVID-19, they have just recently allowed nurse practitioners and physician's assistants to certify patients' eligibility for home health. So the way that you obtain referrals in the home health industry is possibly a patient could have been in the hospital post surgery and now needs some physical therapy, occupational therapy, certainly skilled nursing, because what home health covers is extensive wound care, intravenous therapy, pain management, um, case management, and high tech nursing, where the nurse goes in, assesses, and monitors. We are not in there for the long term. We are there in order to provide short term skilled services and get the patients independent, teach the caregivers how to care for their family member or the individual who's receiving home health benefits under their Medicare Part A. Another thing is, where do we get referrals for home health? It could be specifically a physician calling in a referral right from the physician's office. It could be somebody who's been in the emergency room who now needs care at home, who didn't get admitted to the hospital. You do not have to be admitted to the hospital in order to receive home health at home in your place of residence. We could see you at your home. You could live in assisted living. You could live in a hotel, and that is your place of residence. And that's where these professionals can come out and provide the care to you. The key with the home health under the Medicare regulations is that the start of care, from the time that the agency gets the referral to the time the start of care, is within 24 to 48 hours. And what happens is the nurse goes in generally and develops the plan of care with the participation of the patient and the caregiver or the significant other, and develops the plan of care. And then we build on that plan of care over the period of time that we're going to be in there caring for you. And like I said, those 6 services, oh, I forgot to mention speech therapy. So we have nursing, physical therapy, occupational therapy, speech therapy, the home health aide, and the social worker. So depending on what the nurse creates as the plan of care and what the individual's needs are, that would determine what services go in and care for the individual. Just because you're receiving home health doesn't mean that you'll have all 6 services. So it's very, very specific, and certainly the physician will, certify that. The key is, though, in order to meet the eligibility requirements, you have to be homebound during the time that we are providing care for you in your home. And what homebound means is generally you have it's a taxing and difficult effort to leave your home. You might need the assistance of an individual or the assistance of an assistive device like a cane or a walker or even a wheelchair. and that would qualify you because you are allowed to go out to your medical appointments. An individual cannot go out and be a mall walker in the mall. They can't go out to a senior center and play bingo or have lunch dates. So during this time, you are, certainly homebound, considered homebound. If you have an unusual circumstance, like, in the event that your granddaughter is getting married, you are allowed to attend that, but it's very infrequent that you would be going out of the home. Once in a while, you can go to the beauty salon or go to the barber and get your hair cut, but there's many criteria that needs to be followed. And with Medicare involved, you have to be sure that we're following the conditions of participation, the federal regulations, and certainly the standards of in your own state. So another criteria is, in order for you to have home health care, you have to have a face-to-face encounter with the physician, and the physician has to determine that you qualify and you're eligible and you require home care services, because otherwise you can go, to the physician's office, you can go to a wound care center. So why is it important that you need a professional coming specifically to your home? So on admission, we're already anticipating discharge. We start the admission and we're determining how many weeks and what the frequency of the visits are going to be in your home. And we lay out the expectations to the family or to the caregiver, because we need participating individuals, whether it be the patient who can participate in the care or the family to participate in the care, in order to keep that patient safe at home. Um, we also, you can even do a self referral if you feel that you are in need of home health services. You can call the agency and refer yourself, as long as you're a physician. We would then follow up with your physician to be sure that he has had a face-to-face encounter with you, and then we could start the services then.
So,
Then.
Serena, let me just interject there. Can you explain what is the typical time under the home health um, episode? How long does typically, when someone comes under the Part B, is that period of time?
Well, this home health is covered under Part A, Medicare Part A, not B. B is the outpatient portion of home health. But when we're talking about home health, it's Medicare Part A, and there is no cap in terms of the time frame. So, God forbid, in the event that you have a very extensive wound, it can take 6 to 8 or 10 weeks in order for that wound to heal. We might
Right,
we might go in 3 times a week, and as the wound is progressing and the family is participating, we might drop down to 2 times a week and then 1 time a week. So
right.
it's all based on the acuity of the individual.
And that's recertifying. That period or that extension is called recertification.
An episode of care is a 60-day certification period.
Right.
If they go beyond the 60-day certification, then we would be recertifying them for another 60 days. It doesn't mean that necessarily they will be on for that full 60 days, but the physician has approved a 60-day certification period.
Right. And I'd also just like to mention, I know that when, we used to work together, me being in the home under home care or even under a case manager scenario, is that if I saw that there was some change in a client, I would call you at home health and say, hey,
Yeah,
this is going on. Maybe there's some wounds going, a skin tear that is occurring. But even us as home care owners, guys, is that we're able to actually initiate that call to home health. If you
yeah.
observe it, have your home health, connection available to you. to make that call and to make the referral. It does go both ways. And similarly, when home health is finishing, to have that relationship that they can refer to you to pick up and continue under home care private.
For private care.
Right,
Yes.
Serena?
Yes, absolutely. And while they're receiving the home health care under Medicare Part A, they can still continue to receive their private care as well.
Right.
Mm-hmm.
So there's two services that are allowed into the home at once.
Yes.
Right. So how would you say, and just in closing, Serena, how would you say for our owners out there, one of our biggest things that we talk about is how we formulate relationships, how we going to, market and promote our services. And I, echo all the time is that, you have to go out there, you have to form relationships. And it's with anybody that's related to the care or the continuum. How would you describe the best way in creating that relationship and forming that collaboration for home care and home health in your experience?
Yes, so you definitely want to work with the home care agencies, want to work with the home health agencies because, first of all, you want to keep the patients out of the hospital. That's a win-win for the patient, for any agency, because that is looked at very closely. That what is the delivery of care and why are these patients returning back to the hospital? So by partnering up with a home health agency, you are able to provide additional services at no cost to the patient and keep that patient safe at home and still be able to get the care that they need, whether it's infusion therapy, whether it's wound care, whether it's teaching and education on, a feeding tube.
Right.
There's so many things that can be done at home under the Medicare Part A benefit that you want to be able to keep your patients and clients at home so that you can continue seeing them and the aides that they have developed relationships with already. And then you have the professional clinical end being brought into the home. So you need to go out
Right.
there and market yourself in terms of what you can do and how you can partner together.
Well, I so thank you, Serena. And I know there is so much to talk about, and we only have just a little amount of time. But as I mentioned earlier, this is going to be a part of a three-part series of what is home health. Serena is going to be back with us to discuss the clinical aspects of home health and the regulatory aspects of home health. So we're going to delve in just a little bit further, but they're all very, important areas that we need to understand. And the more that you get involved into your walk of marketing and promoting is the more that you're going to be able to put the pieces together and understand how you can form collaborations with home health agencies within your community. So, Serena, I so thank you very much for your time today. I'll be
My,
looking forward to the next series. Please make sure you come back and see us again soon. Your
absolutely.
education, you're a wealth of knowledge. I've learned so much from you over the last 20 something years. So I can't thank you enough. So for that, I'm going to say goodbye and we'll see you again soon.
All right. Thanks so much.
Thank you.
Bye.
Bye bye.